All right, get ready to dive into a field that's always fascinated me, neurosurgery. I got some really intriguing research on subarachnoid hemorrhage, SAH.
SAH, yeah, it's serious stuff. A life-threatening type of stroke, really.
Exactly. And we're going to break down why it's so serious, the challenges in diagnosing it, and what the latest is in terms of treatment. Should be a fascinating deep dive.
Absolutely. It really highlights how incredibly complex, how delicate the human brain
Right?
really is.
That's what I find so captivating about this area of medicine. So
Def-
before we get into the nitty-gritty, what exactly are we talking about when we say subarachnoid hemorrhage?
Okay, so picture this. You've got the brain, right?
Right.
And it's encased in this, delicate buffer. We call that the subarachnoid space. Now, imagine a bleed happening right there in that very space.
Yeah, I'm picturing it.
So that, in essence, is SAH. And it's a big deal because it's not just a neutral event, this bleeding. It irritates the brain tissue, and it can actually disrupt the flow of cerebrospinal fluid.
Cerebrospinal fluid, that's essentially what, the brain's lifeline.
Exactly. It's how the brain gets nutrients, clears out waste, that everything.
So with SAH, we're talking about a vital system in complete disarray.
Precisely. And that's what makes it a neurological emergency. That bleeding, the pressure buildup inside the skull, it can cause serious damage, so rapid diagnosis, rapid treatment are absolutely critical.
Definitely drives home the seriousness of this condition.
They-
Now, you mentioned earlier, and the research touched on this too, that SAH isn't just something that happens to, say, older adults.
Right. That's a common misconception.
Yeah.
It's most common, I'd say, between 40 and 60, but we're seeing it in younger adults, even teenagers. It's not just an older generation concern at all.
It's an important reminder that SAH doesn't discriminate. And to add another layer to that, there's also a gender bias. The research mentioned women being more susceptible.
That's right. It's a slight increase in prevalence, but it's definitely there. And why? Well, that's one of the many mysteries researchers are still trying to unravel.
Mysteries abound. And another one, at least the way it's often portrayed, is this idea of SAH being instantly fatal. Is that Hollywood taking liberties again, or?
Thankfully, it's not always the immediate death sentence we see on screen.
Okay, that's reassuring.
But, and this is a big but, even with the advancements we've made in treatment and diagnosis, SAH often leaves survivors facing a very long, very challenging road to recovery. The impact on their quality of life is significant.
So not the instant fatality we often assume, but definitely long-term impacts that need to be addressed. It's definitely a lot to unpack, and we'll get to those long-term impacts for sure. But first, I'm curious about what actually causes this type of stroke. I mean, you mentioned those medical traumas, right? Someone
Yeah.
takes a hit to the head, and suddenly it's a brain bleed. Not usually how it works in real life, is it?
You're right, those scenes are more for, well, dramatic effect than medical accuracy.
Right?
The most common cause of SAH is something called a ruptured cerebral aneurysm.
Aneurysm. It's one of those words I hear it, but I'm not sure I fully grasp what's happening in the, blood vessels?
Think of your blood vessels, like imagine a network of pipes.
Okay.
An aneurysm is like a weak spot in the wall of one of those pipes. That spot, it starts to bulge out, under the pressure of the blood flow.
Oh.
And when that bulge, that aneurysm ruptures.
SH?
Exactly.
So it's like I don't know, like a ticking time bomb in this incredibly intricate system in our brains. Are these aneurysms found anywhere in particular, or is it totally random where they pop up?
They're not totally random. A good number of them, they tend to occur in an area called the Circle of Willis. Think of it like, a major intersection of arteries at the base of the brain.
So higher traffic, higher risk of like a fender bender.
Exactly.
Makes sense.
Hmm.
Now, speaking of those Hollywood portrayals, they often nail that whole clutching your head in agony thing. Is that actually a real indicator of a ruptured aneurysm?
It can be, yeah. A really sudden, excruciating headache. People often describe it as a thunderclap headache.
Wow.
It's the body's way of, well, kind of screaming that something is very wrong.
I bet that's when most people realize, okay, got to get to the ER. Like now.
Absolutely.
But you've sort of hinted at this idea that there are all these factors at play with SAH, and it's not always so clear cut. Does that hold true for risk factors as well?
Oh, absolutely. It's not always as simple as pointing to one thing that increases your risk. It's really interesting, actually, this interplay of both modifiable and non-modifiable factors.
Okay, so modifiable meaning things we have some control over?
Right. Lifestyle choices, things like that. Smoking, for example, that's a big one. High blood pressure. Even excessive alcohol consumption, those can all increase your risk.
So there's that personal responsibility angle. What about the non-modifiable factors? Those sound a bit more like, well, bad luck of the draw.
They can be, yeah. Genetics play a role, definitely. Family history of aneurysms, certain genetic conditions, those can increase your susceptibility.
Sobering thought that even if you do everything right, there are some risks you can't outrun. Which I guess makes me think about the diagnostic process. With something as complex as SAH, where do doctors even begin?
You're right, it's complex. Diagnosing SAH is kind of like putting together a puzzle. And speed is everything. Every minute matters. The faster we can get that diagnosis confirmed, the better the chances of a positive outcome. Usually the first step is a non-contrast CT scan.
CT scan. Is that the same kind of scan you'd get for, like, other head injuries?
Similar. But in this case, we're looking for specific signs of bleeding within the brain. And a CT scan is great for that. It can pick up that blood very quickly. It can also show us if there's hydrocephalus, which is a buildup of fluid in the brain, and any signs of swelling as well.
So it's like that first line of defense, that CT scan, get a quick assessment. But the research you shared, it mentioned that sometimes a CT scan isn't enough for a definite diagnosis.
You're right. If the CT scan isn't clear, but we still have a strong suspicion of SAH based on, symptoms, medical history, then the next step is often a lumbar puncture.
Lumbar puncture. Most people probably know that as a spinal tap, right?
That's the one. We use a very, very fine needle to extract a small amount of cerebrospinal fluid from the lower back. And by analyzing that fluid, we can look for traces of blood or specific signs of, blood breakdown products that wouldn't be there otherwise.
Fascinating how such a tiny amount of fluid can be so revealing. So once SAH is confirmed, what happens next? Is it all about stopping that bleeding?
Absolutely. Stopping the bleeding is the priority. But to do that effectively, we need to find the source. And if it is a ruptured aneurysm, which is most often the case, we need to locate it precisely. That's where a CT angiogram comes in.
Angiogram. So we're getting a detailed look at the blood vessels themselves.
Precisely. It gives us a high-resolution map of the arteries in the brain so we can pinpoint the exact location, the size, the shape of that aneurysm. Crucial information because it helps us figure out the best way to treat it.
So we've got our diagnosis, we've pinpointed that aneurysm.
Yeah.
Feels like we're at this really critical point now actually treating the SAH. What are the options?
You're right. This is where the neurosurgery really comes in. And you're also right. The absolute first priority is securing that aneurysm, making sure it doesn't bleed again. Because a second rupture, that's when the outlook gets much more grim. So there are two main approaches we use, and they've both revolutionized how we manage SAH.
Okay, so two different paths, but both aimed at preventing another bleed. Let's break them down. What's the first approach?
The more, I guess you could say, traditional method is surgical clipping. It's very much what it sounds like. A neurosurgeon performs a craniotomy, opening the skull, basically, to access the brain. They locate the aneurysm and then use a tiny specialized clip to seal off its base. So you're essentially stopping blood flow into that bulge.
It's incredible the precision involved in that kind of procedure. Working within the brain like that, it really is like artistry almost. But the research you shared, it pointed toward a newer, less invasive technique becoming more common. Is that endovascular coiling?
That's the one. Endovascular coiling is a great example of how technology is changing medicine, really. So instead of opening the skull, we use a catheter.
Catheter being?
A thin, flexible tube. It's inserted into an artery, usually in the groin, and then, this is the amazing part, guided all the way up to the brain, directly to the aneurysm.
It's like navigating this tiny vessel through the body's highway system, straight to the source of the problem. So what happens once the catheter reaches the aneurysm?
That's where the coiling comes in. The catheter, it deploys these tiny platinum coils into the aneurysm.
Okay.
And these coils, they actually trigger clotting. So it's like you're plugging the aneurysm up from the inside. No more blood flow, no more bleeding.
So with clipping, we're closing the gate, and with coiling, we're plugging the leak from within. Same goal, secure that aneurysm. Is one of these methods inherently better than the other?
It's not always so black and white. There was this landmark study, the International Subarachnoid Aneurysm Trial, ISAC. It directly compared clipping and coiling. The results were pretty significant. They found that, in many cases, coiling led to better long-term outcomes for patients. However,
there's always a however in medicine, isn't there?
Right. The decision about whether to clip or coil, it's very case-specific. The size of the aneurysm, where it's located, the patient's age, their overall health, even the expertise of the medical team, it all factors in.
So it's a real team effort, carefully weighing those risks and benefits for each individual patient, which highlights, I think, how important it is to have access to, really skilled specialists when it comes to SAH.
100%. We're talking about a team of neurosurgeons, interventional neuroradiologists, anesthesiologists, neurocritical care specialists, all these experts working together.
Wow,
Yeah.
it really does take a village. But let's say that aneurysm has been successfully secured, clipped, or coiled. Is the patient in the clear at that point? Or is there still a long road ahead?
That's the thing about SAH. Securing the aneurysm is often just the first battle in a longer war. Even when that initial threat is addressed, there's a risk of complications, some of them quite serious, that can have a big impact on a patient's recovery.
So SAH is complex, to say the least. What are some of those potential complications we need to be aware of?
One of the most concerning is delayed cerebral ischemia, DCI.
DCI.
And that is,
It's actually a major cause of long-term disability after SAH. What happens is there's a reduction in blood flow to parts of the brain.
so even though the initial bleed has been addressed, the brain might not be getting all the oxygen-rich blood it needs. What causes that to happen?
It's interesting. Initially, DCI was thought to be solely due to vasospasm, basically those blood vessels near the aneurysm constricting.
But it turns out it's much more nuanced than that. We now know that inflammation plays a role, and tiny blood clots, even changes in the brain's electrical activity, can contribute to DCI.
It's like this domino effect.
Right.
One problem, and suddenly you have this cascade of other issues in this very delicate system, the brain.
Perfect analogy. And because it is so complex, DCI can be tough to treat. Prevention is key, but even then, it's not always avoidable.
So that's one hurdle, DCI. What other challenges might patients face on their road to recovery?
We see hydrocephalus developing pretty often. Remember that buildup of cerebrospinal fluid in the brain?
Right.
SAH can really disrupt the normal flow of that fluid, which
Yeah.
leads to increased pressure inside the skull. And obviously, that's not good.
Like the brain's drainage system is backed up. How do you manage hydrocephalus?
In a lot of cases, it requires surgery. We might implant what's called a shunt. It's basically a small tube that helps to drain that excess fluid, relieve the pressure.
Another delicate procedure, but one that's crucial. Any other common neurological complications associated with SAH?
Seizures. Seizures are a big concern. They happen in a surprising number of patients, and managing them can be tricky because some anti-seizure meds, they can actually worsen outcomes in people recovering from SAH.
Always that balancing act, right?
Yeah.
Trying to address one problem without creating another really highlights how interconnected everything is within the brain. But you mentioned earlier that SAH can have impacts beyond the brain as well, even affecting other organs.
Yeah, it might seem counterintuitive, but the brain and the heart, very connected. SAH puts a huge amount of stress on the cardiovascular system, and that can lead to things like arrhythmias, that's an irregular heartbeat, and in some cases, even heart attacks.
Wow, so a bleed in the brain can actually impact the heart that significantly.
Mhm.
How does that connection even work?
Think of it like a communication breakdown. The autonomic nervous system, that's the system that regulates, heart rate, blood pressure, all the vital stuff, it gets thrown out of whack by the stress of the SAH.
Okay.
And that can trigger all these hormones that can actually damage the heart, disrupt its rhythm, the whole 9 yards.
The brain sending out distress signals with some unintended consequences.
Yeah.
Now, on top of all that, the research you shared mentioned electrolyte imbalances being a concern as well.
Definitely. Electrolytes, they're essential for, well, pretty much everything. And SAH, it can throw off their balance. Sodium levels especially. We see a lot of hyponatremia in SAH patients. That's low sodium in the blood. And if it's not managed carefully, it can lead to a whole other set of problems.
It's amazing, and by amazing I kind of mean terrifying, how that one event, that initial bleed, can have this ripple effect throughout the body. Really underscores that recovery from SAH isn't just about, addressing that initial injury. It's about managing this whole cascade of potential issues.
Exactly. SAH has far-reaching consequences, and that's why it's so important to understand not just, that initial event, but the potential for long-term impacts as well.
Which I think brings us to the big question. What is the long-term outlook for someone who's experienced an SAH?
$1 million question, and unfortunately not one with easy answers. Every patient is different. Their recovery is going to depend on so many things. How bad was the bleed? Did they have complications? Their age, their overall health, even their support system.
There's just so many variables at play. But the research did indicate that even with the medical advancements, there can be lasting effects, especially when it comes to cognitive function.
Yeah, that's one of the biggest challenges with SAH. We see people who've had good physical recovery, but they still face these ongoing struggles with things like memory, attention, concentration, what we call executive function. And these cognitive issues, they can have a huge impact on their daily life, their work, relationships, everything.
It's a good reminder that recovering from SAH is not just about healing the body, it's about addressing those invisible wounds as well, the cognitive and emotional toll it can take.
Absolutely, and that's why the research is so crucial. Scientists are working on better tools to predict who's most at risk for things like DCI, more effective treatments, even exploring completely new therapies that could improve long-term outcomes. There's a lot happening in the field.
That's encouraging. Any specific areas of research that you're particularly excited about that seem to hold particular promise?
Oh, absolutely. One that's really interesting is CSF filtration. So this involves actually filtering the cerebrospinal fluid directly.
Okay.
The goal is to remove harmful substances that build up after an SAH, those things that contribute to inflammation and damage, almost like giving the brain a detox in a way.
Wow, that's incredible. It sounds almost sci-fi, but in a good way. Any other cutting-edge approaches being explored?
Another one is cisternal lavage. It's a technique where they rinse the area around the brain with these specialized solutions to bring down the inflammation and clear away blood byproducts that can be toxic to brain cells.
Fascinating.
And then there's some really interesting research into something called stellate ganglion block. So this one involves injecting an anesthetic near a cluster of nerves in the neck, and early studies suggest it might actually improve blood flow to the brain, potentially a way to lessen the severity of DCI.
It's encouraging to hear about all this research, all these different avenues being explored.
Hmm?
Really speaks to the complexity of SAH, but also to the dedication of all the people working to improve the lives of those affected by it.
Couldn't agree more. It's a field that's constantly evolving, new discoveries all the time. And the goal is not just to help people survive SAH, but to really thrive, to regain their cognitive abilities, their independence, their quality of life.
Well said. This has been such an eye-opening deep dive.
Yeah.
From the intricacies of the brain to these cutting-edge techniques to really understanding what it means to recover from something as life-altering as SAH.
Absolutely. And if there's one key takeaway I hope you remember, it's that SAH. It's complex, it's challenging, often unpredictable. But with all the research, all the advancements in care, there's always hope for better outcomes. And just as important, a better quality of life for those who've been through it.
Beautifully put. And to our listeners, as you continue to learn about this complex condition, we'll leave you with this thought. Knowing that even those who physically recover from SAH can struggle with these lasting cognitive challenges, how can we, as a society, better support the mental and emotional well-being of survivors? How do we make sure they have the resources, the support they need, to not just survive, but to truly thrive long-term?
It's a question worth thinking about for sure, and one that I hope will drive even more research, innovation, and compassion in the field of SAH care.
Thank you for joining us for this deep dive into the intricacies of subarachnoid hemorrhage. It's been a privilege exploring this incredibly important topic with you. Until next time, keep those brains curious.